you know, I can take the doctor scribe right in the room with the, you know, in the computer and interview the patient, aim the camera at the patient. The scribe then hears all the interaction between myself and the patient, and then I can add my editorial comments and additions and any clarifications that needed from the interview with the patient. And then two, the scribe can see the physical exam and actually see the areas that are tender, rather than me trying to describe it on the, you know, a dictaphone or whatever. The scribe can actually see the exact area where the findings are, can see the patient's response to the treatment, to the examination, etc. So that works great.
Excellent. And what, I'd like to know the benefits of the hospital, emergency department, the doctor, and the patient. So we could go with, what is the benefit for the hospital?
Well, I think the definite benefit for the hospital is a more efficient emergency department, because it really reduces the amount of time that I spend documenting on the patient, more time that I can spend seeing more patients, so I can be more productive.
And the main benefit for the emergency department?
Again, I think it's efficiency, accuracy, and convenience.
And the benefit for the patient?
Well, all of that, you know, falls to the benefit of the patient, because that gives the provider more time to be with the patient, and as well as the family.
Approximately how much time does the virtual doctor save you?
Boy, that's really hard to quantify, but I'd say at least, you know, time savings 50%. I think it's just really good. I mean, you know, to review the record goes along very quickly. I don't have to, you know, actually compose a document. It's composed as we go along in the process. Like I said, it's all done live. It's so much better than even dictating in a dictaphone, because the transcriber on the other end has to rely on the doctor's wording and vocabulary, and they really don't get the opportunity to see the patient and to maybe document based on what they see as well as what they hear.
And if you were to summarize, what would you say the main benefit of the virtual doctor scribe provides in making you more productive? What would you say is the main reason?
Well, again, it takes me away from the computer, because I don't have to stand there and document all the details of the exam. The scribe does all that.
Would you consider the virtual doctor scribe program a luxury or a necessary tool?
I think it's a necessity. It's definitely a great tool. I think it's a wonderful thing to have. I just see that the potential there is so great.
Do you think that the scribe program is financially viable?
Oh, I think so. I think hospitals look at it and realize the benefits that occur by cost savings in other areas. It may cost them, you know, a little bit to get the scribe system in, but on the other hand, they're going to save a lot of other costs.
And as you know, the virtual doctor scribe is a graduated medical doctor. And how does that particular qualification help him perform his job as a scribe better, because he's a graduated medical doctor?
Well, our history here at Pioneer is that we did have a scribe system for a few months period of time, where actually the person would go in the room with us and record the interaction. Unfortunately, that didn't work very well. Number one, the scribes were not very well medically trained. They were trained in other clerical areas of the hospital. They weren't medically trained like these doctor scribes are. So it just didn't give the same level of expertise and documentation that we needed.
And how does the virtual doctor scribe handle the medical conversation with you, Dr. Perry? Because they are a physician, they're a graduated medical doctor, you're a doctor. How does that medical conversation, I'm sorry. We'll have to. Oh, that's okay. Okay. Okay.
Your screen, our screen went blank.
It went blank.
Black, and we lost it.
We lost it. Okay, no problem. And,
well, we're talking the same language. I mean, it's like with this other scribe that we had. They weren't medically trained. We had to train them on the jargon of the business, the profession. So they're here with these medical doctors. We don't have to do that. They know all the jargon. So we can speak in our normal conversation that we would with any other doctor.
And because our virtual graduated doctors, they're just recently graduated, how do they handle the documentation on a medical level?
Oh, superior. I mean, they're just right there. I've been very impressed with their training and their knowledge. Like I said, we don't have to explain things to them.
Because the virtual doctor scribe is a medical doctor who is bilingual English and Spanish, explain to me the level of medical language assistant the scribe performs when interpreting.
Oh, it's incomparable to any other service. I mean, we have, interpreters that don't have that medical training. I mean, they have training in kind of the medical Spanish, but it's not the same level. Like, for example, today I was telling you about a patient that came in, spoke Spanish, had a seizure. It was a complicated situation. Our medical doctor scribe jumped right in and helped with the interpretation, could ask the questions in the right manner, with the right language for both sides of the conversation, both medically as well as the patients. So we got a much better interaction with the patient, a lot more accurate information that way.
And as far as have you noticed any particular comments whenever the patient sees the virtual doctor scribe? What does the patient say?
It's a very positive thing in my estimation for the patient, because I'll introduce the scribe to the patient, kind of explain the situation. It's important to not say that they're recording, because they'll see the screen they'll see themselves on the screen. They're a little skittish about being recorded videoly. But if I just tell them that we have the scribe there that's typing the record, and just there to type up the record for us, they actually interact with the scribe a lot more than they interact with me sometimes. So they'll be talking to the scribe and making sure the scribe understands what's going on. I don't know that I've ever had any negative response from a patient on this.
And as far as the patient satisfaction, how would you rate the level of patient satisfaction?
I think it's got to be high. I mean, like I said, I get positive feedback. They seem to interact with the system very well, sometimes more so than with me in the room, just alone without a scribe.
How is it possible, Dr. Perry, to achieve increased RVUs by working with a virtual doctor scribe?
Well, the chances of getting more complete documentation is a lot higher with the doctor scribe, because they're focused on the document, getting the document completed, and to include all of the aspects of the patient care. Whereas the physician is more attuned to getting the patient taken care of and is less concerned about the document and getting all the documentation. And therefore, the doctors may tend to not document enough to, they may forget to document that they cauterized a nosebleed, or they didn't get the complete laceration repair documented, etc. So there's a whole host of things that the doctor could miss on the documentation, and it would be hard to pick up some of that stuff to actually quantify that.
And Dr. Perry, as you know, it's also possible to just take audio into the patient's bedside. But what would you say is the principal advantage of having video conferencing with the scribe at the patient's bedside?
Well, like I said, the patient sees the scribe, sees what we're doing, kind of focuses on the scribe sometimes. The scribe can then see the interaction between myself and the patient, and makes a better record, I'm sure. It just has to be better than just sound alone. Like this old saying, picture's worth 1,000 words. There you go. We lost you again, but we got you back. Okay.
And for new doctors, Dr. Perry, what would you say is the average length of the learning curve for a physician to begin using the virtual doctor scribe?
A day at the most. Yeah. I mean, by the end of the day, you're pretty well up to speed on using it.
As far as room for improvement for the virtual doctor scribe program, because this is a very innovative and the only one in the nation, and your hospital has been selected as the pilot site. Are there some things that you would recommend for us to take a look at as for room for improvement?
Well, that's a tough question, because I'm just so excited about the whole product itself that it's hard to see a room of improvement. Now, what we have now compared to what we used, several months ago or a year ago or more, you've already improved it quite a bit. You've got the camera that we can turn around and aim at the patient better. Than we got the better screen situation set up so that the scribe and I can see the same thing on the screen at the same time. That's just a great enhancement.
Well, very good. Dr. Perry, on behalf of Medvex, we'd like to thank you for piloting our program, and we wish you lots of success with our program here at Pioneer Hospital.
Okay, I'm excited for it here, and that's great.
Yes, sir.
Thank you so much for bringing it to us.
Yes, sir. Thank you, Dr. Perry.
All right.